Medical assistance in dying saved the heart of medicine. It's a pretty paradoxical statement, isn't it? But I heard this once from someone who sat at the very forefront of medical aid in dying, or MAID, practice in Ontario. It should come as no surprise here that we have a little bit of a death-denying culture in Canada. It makes it really difficult to have these end-of-life care conversations in a way that's meaningful and impactful, despite the fact that 60% of our deaths occur in hospital. Within that context, 91% of patients will not have an end-of-life care conversation with their clinician. 80% don't have a written end-of-life care directive. 50% don't talk to their families about what their wishes are when they die. This is intrinsically problematic because it means we have a lot of dying occurring in hospital that is not values-based, isn't holistic, doesn't integrate those really important personal factors of end of life. And so again, it should come as no surprise that there are 5 affected loved ones every time someone dies. Enter MAID. It fundamentally changed that. Not only do they have to have one deeply values-laden conversation with the patient, they have to have 2. And that is a vast improvement. In addition to that, family is often deeply involved in the process. Originally, my research looked at the clinicians that were involved in MAID practice, but now I'd like to turn my attention to the families. 2 studies came out of the Netherlands fairly recently. Both of them looked at MAID-involved families and what that meant, and it demonstrated that these families have a statistically reduced risk of complicated or clinically significant grieving. That's so important. But unfortunately, due to the quantitative nature of it, we didn't get a clear pathway as to why. That's where my PhD research comes in. I am going to interview MAID-involved families at Hamilton Health Sciences to see what has been working really well for them, to kind of get down to that nitty-gritty, what went well. It's a simple procedure, but it's a really complex answer, and it can really only be attained through qualitative data. I think that if we can get to the bottom of this, if we can see what is working well, not only can we improve MAID practice generally, but we can improve end-of-life care practice in a holistic way for not just patients, but for their families as well. We can make medicine that is values-laden. We can do medicine that incorporates this holistic model of care. We can do medicine with heart. Thank you.